It's time to take another look at how fascinating the human body is. Today, we'll specifically look into our blood, how it works, how it nourishes the body with oxygen and other nutrients, and how it carries away waste products, which the liver, the kidneys, or the intestine can then get rid of. Our blood also tells a lot about our overall health condition. I'm Dr. Freddy Gomez. Welcome to MedTalk Health Talk. Many of us have gone through blood tests. Your doctor will be the one to request it as part of your annual physical. Or they're done to keep track of a medical condition. There are a number of different reasons which we'll talk about more with our guests. Joining us now are Dr. Jesus Relos. He's a hematologist from the Makati Medical Center, and Ms. Crisanta Onsaga, who is a registered nurse. We're glad to have you both with us today.
Thank you for having us.
Now, let's begin by talking about the most common blood tests and why they're requested or may be required by your doctor. Could you explain this a little bit more, Dr. Relos?
Well, from an internist and a hematologist point of view, we request blood tests. The most common ones, of course, is the complete blood count. It tells us whether one is anemic, one has infection, depending on the WBC count. Or if one has a tendency to bleed, if the platelet count is low. Of course, the other biochemical parameters, the metabolic parameters, can also be requested. Your sugar, your cholesterol, your uric acid, functions of the different organs, creatinine, liver function test. And sometimes we want to check tumor markers or product of infection. These are the most common ones we
Okay, so
request.
there's a lot that we can know about a person with their blood test. But a blood test is not the only test needed to fully understand a person's overall health condition. But that is one test that which can say a lot. So we want to know the many different reasons why your doctor or nurse will ask for a blood test. Let's start with Ms. Nurse Onsaga. Before undergoing a blood test, Ma'am Onsaga, meron din po bang restrictions na kailangan malaman ng ating mga viewers? Anong mga dapat tandaan ng mga taong magpapa-blood test?
Yeah, kailangan yung, of course, the consent coming from the patient. And before we have to start with the procedure, it is very important for us to identify also who can give blood. Like, for example, the ages should be between 18 and 65. And we also have to consider the 50 kilogram and above na weight nila. And going back, sabi ko nga, it is important for us to identify ourselves to the patient, at the same time to accurately get the complete name of the patient also before proceeding with the procedure. And we also have to give them a thorough instruction, making it sure na naintindihan ng pasyente what we are trying to discuss. If possible, we nurses discuss it in layman's term para ito ay maintindihan nila.
Mm-hmm. Now, Dr. Relos, can you tell us the reason why blood testing is very important?
Yes, blood testing is very important because it reflects the health status of an individual and some disease states. If one is complaining of dizziness, easy fatigability, then it's important to check the hemoglobin level because hemoglobin or the red cells carries the oxygen to the different parts of the body. And these symptoms are red flags for abnormalities in your red count. If one has fever, again, we want to check, is the white blood cell count high? Is there infection? If the patient complains bruising, bleeding, then we want to check the platelets.
Now, sometimes your doctor will ask you to fast or not eat or drink for a certain period of time before a blood test. Let's explain this to our viewers, Dr. Relos.
Well, some tests will be affected by a recent meal. Most obvious, of course, is your metabolic parameters. No? So the sugar expected to be high after a meal. The After a high fat meal, the cholesterol level also and the quality of the blood can be affected because it varies depending on the recent meal or the time of the day you're taking the blood test.
Pag-usapan naman natin ang handling of blood samples. As a nurse, how crucial is it to properly collect and label the specimen before it gets to the laboratory?
Yeah, pag kumukuha tayo ng blood sample sa patient natin, of course, we have to practice always the universal precaution and consider all those products potentially infectious. And of course, we have to complete the doc yung pagkuha ng specimen within a specified time and should be brought in the laboratory timely. Kasi pwede pong mag-lapse yun. Ano? Like for example, we have to complete it within the specific period or hours lang. Pag nag-extend pa po doon, like for example, the period of over 2 weeks, kailangan pong naka-frozen na po yun and to be stored with a specific temperature lang siya.
Now, some of you may have heard your doctor saying you have an infection after a blood test. That's because he or she is seeing a high white blood cell count. Dr. Rilos, pag mataas ang white blood cell count, what's the immune system doing?
The way I explain it to the patient, I tell them, kung meron kayong lagnat or may maliwanag na dahilan kung bakit kayo lalagnatin, may sugat na hindi gumagaling, may obvious infection, then a slight increase in the WBC is actually good. No? WBC is helping them fight infection. Now, it's a different story when you see a seemingly healthy patient with a high WBC or showing gradual decline in health. So that's when we suspect the possibility of leukemia.
Coming up, we'll be talking about some common blood conditions, what the symptoms are, and how they can be treated. Back in a moment, right here on MedTalk Health Talk. So nice to have you on the show today. You're watching MedTalk Health Talk. One of the most common blood conditions is anemia, which happens when a person doesn't have enough healthy red blood cells to carry adequate oxygen to your body. Now, Dr. Rilos, my question is, what happens to someone who has anemia? Ano bang mga causes nito?
Ang common ay, of course, may bleeding, kakulangan ng iron, pwedeng sa diet or from bleeding. No? With every ml of blood that we're losing, we're also losing iron. So for females, those who are menstruating regularly, they, especially if it's regular, but when extremely profuse, then they can develop iron deficiency eventually. If we're not able to address the anemia, then target organ damage can follow. For example, patients can develop heart attack because of lack of delivery of oxygen to the heart. Well, the other organs are also sensitive, the kidneys, the brain, and that's why we need to really the identify the level of hemoglobin and correct it as soon as possible.
Now, Nurse Gonzaga, what are the important signs that one has to monitor when it comes to knowing anemia?
Yeah, the manifestations that we have to check to our patients with iron deficiency anemia, which is the most common nutritional deficiency, just according to the World Health Organization. We have to check for the client is pale. They can also manifest shortness of breath, easy fatigability or tiredness. Madali silang mapagod because nagdi-deplete din yung oxygen that is being transported, okay, to the other part or different parts of the body.
That's right. But there are ways to prevent anemia, and that is what we want to know more about. Dr. Rilos, can you help us explain how can someone prevent having anemia?
We need to identify the cause. No, if one is not avoids if one is a vegetarian, so you don't get much nutrients, then you can develop anemia. For females, one should know the amount of blood one loses per cycle, and then correct, no, supplement with iron. No, we can also monitor. No, we can monitor the CBC and address properly if one already has declining hemoglobin level.
Now, another blood disorder is leukemia. And according to the health department, leukemia is among the top 5 killer cancers in the country. In order to raise awareness and for people to better understand leukemia, the month of September is also known as Leukemia Awareness Month. It coincides with Blood Cancer Awareness Month, which is also celebrated internationally in September. What happens to a person with leukemia, Dr. Rilos?
Yeah, a person with leukemia has overproduction of white blood cells. No? It starts to crowd the circulation, not giving enough space for the normal ones to develop. The problem is that the white blood cells produced are non-functional. They are stuck in their immature stage, and thus not able to help fight infection, not to and they're not able to improve one's immunity.
Okay, now for Nurse Onsaga, how about the care given to people with leukemia? May mga routines ba that they need to undergo during treatment?
Yeah, of course, in caring for the patients, we have to be familiar with the manifestations, like what Dr. Rilos mentioned, that patients with leukemia, lagi silang nagkakaroon ng repeated infection. We also have to check for the sudden weight loss. Isa ito sa parameter na biglang pumapayat nang wala namang dahilan and masyadong mababa yung timbang ng ipinayat niya. Nursing considerations if the client will have to undergo chemotherapy as one of the major treatment modality for leukemia. Also, yung bruising, no? We have to check on the bruising of the client. Madali po silang nagpapasa-pasa and also to check for epistaxis or in layman's term, yung pagdudugo po ng ilong kasi that could also indicate na yung isa yan sa mga manifestations ng cancer.
Now let's discuss briefly the causes and symptoms of leukemia. Could you help us with this, Dr. Rilos?
The recognized causes include one, there are patients that are predisposed. There are familial type of leukemia. There are genetic conditions that can lead to leukemia. Now, those with Down syndromes, for whatever reason, they eventually develop leukemia. Exposure to benzene. So, what are the commercial uses of benzene? So, it's in gas, crude oil, and plastics. High dose radiation can cause leukemia. There are other blood disorders that can evolve to leukemia, like myelodysplastic syndrome, and sometimes it's called a pre-leukemic state. Um, Previous treatment for cancers can also predispose to leukemia, chemotherapeutic agents, and again, radiation. And basically, these are the recognized causes of leukemia.
So if you experience any of these symptoms, please go see your doctor. You're watching Med Talk Health
Yes,
Talk.
definitely.
Ahead on the program, we'll tell you some of the best food for you to increase blood flow and circulation. More after the break. Stay with us. Your health is the most important and long-lasting wealth. Welcome back to the program. I'm Dr. Freddy Gomez, and you're watching Med Talk Health Talk. We've been talking to you about the human blood, which has many functions in the body. There are certain types of food that are perfect to help increase blood flow and circulation. Let's talk about these different types of food. Could you start us off with this, Dr. Rilos?
Well, the production of red cells will need um, iron. The red blood cell production uses much of the iron that we take. So it's important for us to take iron-rich food, iron-fortified food, folate, B12 are also used in blood production. But you know what? Basically, I think a balanced diet taken in moderation can help sustain good blood production.
And before we go, we do want to mention that donating blood can save lives. In fact, the Philippine Red
Yes.
Cross is renewing calls for more blood donors. Call the Red Cross at 879-02300. That's 879-02300. Now, Ms. Onsaga, can you tell us some of the do's and don'ts before and after donating blood?
Yeah, before donating blood, we have also considered the well-being of the client, like the blood pressure of the client. Kailangan wala siyang sakit, walang sore throat, fever, or colds prior to donating, okay, blood. And aside from that, also we have to consider the weight of the client, no? Pag nagkaroon naman ng tattoo, normally, pag nagkaroon ng tattoo yung client mo, it'll take like 6 months bago siya pwedeng mag-donate ng blood. And those people with communicable diseases, no? Like for example, HIV should not be donating blood, no, to patients.
Ano po ang mga health benefits ng blood donation, Nurse Onsaga?
Mag-i-improve po kasi yung circulation. And of course, that's aside from improving the circulation of the client, no, that also supports the Humanitarian Act because in 1994, hindi po ba yung National Blood Donation Services has been mandated, no, under the Republic Act 7719 na it is part of Humanitarian Act to donate blood to safe blood to people.
Okay, very good. Now, my last question is for Dr. Relos. Dr. Relos, if there was one thing that you would like to tell our viewers that they should take from this episode or that they should know about the health of their blood, what would it be?
Well, one should be very observant of their own body, and the simple CBC won't take much of your time. So, a regular monitoring, perhaps an annual checkup, you include the basic CBC in your tests, and that can do lots of benefits uh, for you. And if you are healthy, thank you for helping us fill in our blood banks. If your blood picture is perfect, then you're a candidate for blood donation and you can share your blood. And yes, it's a very popular slogan in health save lives.
Very well said. And now, Nurse Onsaga, how about a message for our viewers on probably how to donate blood and how beneficial it is for everyone?
Yeah, we encourage everyone to stay healthy in order for us to save lives also and not to hesitate, no, to donate blood whenever it is needed. mag-inquire lang po. May mga malalapit na Red Cross for you to inquire. Yung iba kasi natatakot to donate blood. Please don't be afraid. Okay? Donating blood is saving lives.
And with that, we'd like to thank our guest, Dr. Jesus Relost, hematologist and internist from the Makati Medical Center, and Ms. Crisanta Onsaga, registered nurse. We appreciate your time. It was a pleasure having all of you on the show. And to all of you out there, thanks for watching. I'm Dr. Freddy Gomez.